Our once great cities have become unlivable, unsanitary nightmares.
President Donald Trump and his administration want to turn homelessness response away from housing and toward mandatory treatment. This is a massive policy shift in addressing a crisis that's getting much worse. More than 770,000 people were estimated to be homeless last year in America. That's a record. And more are falling into homelessness due to high housing costs and low wages. Once homeless, they experience greater rates of mental health and substance use problems. The current nationwide policy, which dates back to George W. Bush, focuses on creating more housing and providing social services to get people off the streets. It aims to stabilize people in permanent housing without forcing treatment. Now that Trump is in office, the assault on the federal policy, known as Housing First, has begun. Although no formal policy has been announced, Trump is pushing a treatment-first approach. He wants to relocate homeless people into large camps and require them to get behavioral health treatment and rehabilitation or face arrest.
And for those who are severely mentally ill and deeply disturbed, we will bring them back to mental institutions where they belong, with the goal of reintegrating them back into society once they are well enough to manage.
Now, local officials are being told by the administration that they will no longer be able to rely on the Housing First policy that has formed the backbone of the U.S. homelessness response system. And massive cuts proposed by the Department of Housing and Urban Development would affect homelessness programs around the nation. This could have lasting negative effects on health and homelessness efforts.